A new Wordle puzzle is online. Click on the link to play.
Listening to the following video may give you clues. Please like and share the videos.
What South Africa's new COVID rules mean for masks at work? What South Africa's new COVID rules mean to masks at work isn't all bad news.
For starters, they end the nationwide state of disaster which had been the source of the mask mandate authority. In response, the President has announced a set of transitional measures which will automatically expire after 30 days.
The transitional measures include mandatory masks in public buildings and public transport, and other rules to be announced by the 4th of May. Face masks will no longer be required outdoors in South Africa.
From 5 April next year, face masks are no longer required outdoors in South Africa. In such circumstances, the national state of disaster will no longer apply.
This rule applies to people in open public spaces, such as a park or beach. People should, however, keep at least a 1-meter distance between them and other people, in order to ensure their own safety.
The rule does not apply to school environments, but there are exceptions. Children and people with disabilities are not required to wear a face mask.
They can also be required to wear a mask if they are suffering from serious skin conditions on their face. In this case, a person does not need to give an official written exemption.
If a person is asked why they are not wearing a face mask, a verbal response is sufficient. In addition to the general mask requirement, people should wear a mask when they are indoors.
Businesses may continue to require employees to wear masks, and individuals are still required to wear a face mask when visiting a healthcare facility or public space. Government sites, schools, and certain congregate settings still require masks, and some private businesses may also require a proof of vaccination.
The Welsh government plans to lift the remaining COVID regulations in March. People should still wear a face mask in enclosed spaces, public transport, and other specified settings.
However, masks are no longer mandatory in all places outside these places. So, the next time you go to the beach or the park, don't forget to wear a face mask.
This way, you won't need to worry about being exposed to dangerous germs. People with asthma will be exempted from wearing face masks outside of COVID-19 isolation centers.
There is a growing concern that the draft regulations introduced in South Africa for COVID-19 may not adequately inform high-risk individuals of the potential risks of occupational diseases, including respiratory disease. That is why the draft regulations specifically require employers to provide employees with shields and cloth face masks.
Although the rules imply that face masks must be worn at work, they do not go so far as to make it compulsory. Changes to the COVID-19 regulations will help the sporting and entertainment industries.
While face masks will no longer be mandatory outdoors, they will remain required indoors and on public transport. The changes will also allow public venues to fill to 50% of their capacity.
Those venues without this requirement must still adhere to the existing limit of 1,000 people indoors and 2,000 outdoor. It is hoped that this will help in the broader fight against the disease.
The researchers note that mask wearing has increased rapidly in South Africa, but the prevalence of mask wearing among elderly workers is lower. Future research should include studies of these groups.
The authors propose a health belief model and a novel rapid mobile survey to investigate the factors that influence mask wearing. While mortality risk does not seem to be a major factor, local social norms are important for predicting the likelihood of mask use.
This study also notes that masks may have become social norms. In fact, the study notes that when asked in closed-ended questions, the majority of respondents said that they wore face masks.
These findings suggest that the messages about masks were effective in promoting compliance. However, the study does not provide the full picture of the COVID rules, and the legal consequences for non-compliance are largely unknown.
These results indicate that mask wearing has a positive impact on the trajectory of COVID-19. The new COVID-19 rules also suggest that masks are more effective when combined with physical distancing strategies, such as hand washing.
Furthermore, mask wearing has a visual presence in a work setting and is therefore an important preventative strategy. But whether this is true, this study should be repeated.
Schools and universities will no longer be closed to prevent spread of Omicrons. As the Omicron variant continues to rage across the country, school systems and hospitals are scrambling to find solutions to protect students and staff.
Several schools in metropolitan Washington and parts of Chicago have moved to temporary remote learning. As the number of cases rises, more schools will likely follow.
For now, the focus should be on preventing the spread of the virus to students. School districts and universities that had been understaffed for years before the Omicron wave hit are not alone.
They faced the same labor market pressures as other sectors. Parents quit their jobs to care for their children, while immunocompromised individuals were forced to quit their jobs.
With this lack of new workers, school districts have had trouble keeping their doors open. However, there are still a number of school districts around the country that are struggling to keep their doors open as a precautionary measure.
After the outbreak, scientists are now concerned about the new strain of the coronavirus, the Omicron strain. The new strain has higher contagiousness than earlier versions of the virus.
Even vaccinated individuals can be infected with the Omicron variant. The latest outbreak of the coronavirus is likely to be triggered by another epidemic.
While the outbreak of Omicrons has not been linked to a major school closure, the rising number of cases in schools and universities is a reason to worry. The Omicronic variant of the virus has been linked to an increased number of pediatric hospitalizations.
Despite this, parents and educators are worried about the safety of their children when COVID-19 is introduced to schools. Atlanta school districts are delaying the start of in-person classes and moving to remote learning from 2022 onwards.
These efforts are being followed by schools and universities across the country. While schools and universities will no longer be closed to prevent the spread of Omicrons at work, many other communities are.
In fact, nearly all U.S. communities have a rate of 4 new cases per day for every 100,000 people.
And while schools and universities can't be completely safe from Omicrons at work, they can still take other steps to protect the community. Its CRAM surveys trends in wearing face masks.
While there are no concrete statistics on the number of workers who wear face masks in the workplace, the NIDS CRAM survey's findings shed light on the issue. The survey's weights represent the views of more than 2 million South Africans, whose exposure to airborne illness can result in fatalities or permanent injury.
The findings indicate that more workers should consider wearing face masks at work. An NIDS CRAM study was funded by the Allen 26 Bill Gray Philanthropy FEM Education Foundation and Michael 26 Susan Dell Foundation.
The NIDS CRAM study was overseen by a steering committee that includes 10 members. Each publication is authored by a particular individual, and the views expressed do not necessarily represent those of the project's other authors.
Papers in the study undergo an internal peer review process before they are published. The NIDS CRAM steering committee is led by Nick Spall. The current NIDS CRAM by and originally included Ingrid Willard and Murray Lebret.
The survey's findings also highlight the role of time and context when it comes to assessing workplace welfare. The NIDS is conducted every 2 years from 2008 to 2017 and covers a wide range of health and socioeconomic factors.
The NIDS CRAM survey was designed to be nationally representative. However, the results of the NIDS CRAM survey are limited to South Africa.